Some men notice it while bathing, some discover it while changing clothes. Others ignore it for months because it doesn't hurt. They simply say, maybe it will go away. But what if I told you that your body could be trying to tell you something? Today, let's talk about hydrocele. A hydrocele is a collection of fluid around the testicle, inside the scrotum. Notice something important. The fluid is not inside the testicle. It collects around the testicle, causing the scrotum to swell. Let's understand how this happens. Before a baby boy is born, his testicles develop inside the abdomen. As the baby grows in the womb, the testicles slowly travel down through a passage called the inguinal canal into the scrotum. While moving down, they carry a thin covering with them. Normally, after the testicles reach the scrotum, this passage closes, but sometimes it doesn't close completely. When that happens, fluid from the abdomen can pass into the scrotum and collect around the testicle. This is called a communicating hydrocele, and it is common in babies. Many of these close on their own during the first year of life. Now, what about adults? In adults, the passage is usually already closed. A hydrocele can develop because the lining around the testicle starts producing more fluid than it can absorb. This may happen after an injury, an infection, inflammation, or sometimes for no obvious reason. The fluid slowly builds up, the scrotum becomes larger. Most of the time, it is not painful. That is why many men ignore it. But as the swelling becomes bigger, it can feel heavy and uncomfortable, especially while walking or exercising. Here's something many people don't know. A hydrocele is not the same thing as a hernia. In a hernia, part of the intestine pushes into the scrotum. In a hydrocele, it is only fluid surrounding the testicle. Doctors can often tell the difference during an examination. Sometimes, they shine a bright light through the swollen scrotum. Because a hydrocele contains clear fluid, the light can pass through it. This is called transillumination. However, an ultrasound is often used to confirm the diagnosis and make sure there isn't another problem. Now, many men become frightened and ask, will a hydrocele make me infertile? A small, uncomplicated hydrocele usually does not affect fertility. However, if the swelling is very large or is caused by another condition affecting the testicle, it needs proper medical evaluation. Another question is, can I just leave it? In babies, many hydroceles disappear naturally. But in adults, if the swelling is large, painful, keeps increasing, or becomes uncomfortable, you should see a doctor. If an infection is responsible, the infection is treated. If the hydrocele is large or persistent, doctors may recommend a simple operation called a hydrocelectomy, where the fluid is removed and the sac is repaired to reduce the chance of it coming back. So remember this, not every swollen scrotum is cancer. Not every swollen scrotum is a hernia. Sometimes, it is simply fluid collecting around the condition called hydrocele. But every new scrotal swelling deserves a proper medical examination because only a healthcare professional can identify the exact cause. Your body always gives you signs. Don't ignore them. If this explanation taught you something new, like, share, and follow for more simple medical lessons. I am still a student doctor. Stay safe.